So in this video we'll discuss about Prodrugs. What is Prodrugs? See, this is drugs. This drugs is taken by mouth. The drugs is going inside, get absorbed. Acidic drugs from acidic medium from stomach, basic drugs from intestine, basic drugs from that basic medium, then it reaches to that circulation. Now I want these drugs should go to the site of action. So our main aim, this one will go to site of action and shows its mechanism of action. So it reaches to site of action, then it shows mechanism of action. But unfortunately this drugs is inactive now. The drugs is inactive now. It cannot shows it mechanism of action. Not all drugs, okay, not all drugs are inactive. Some drugs only inactive. These drugs are known as prodrugs. Pro means inactive. So these are prodrugs. They will become active. Okay, how they will become active, how they will show their mechanism of action. First, this drugs should move to liver. How this one? Now inactive form. Inactive drugs name is called as prodrugs. How they will show that active form, how they will show their mechanism of action means first these drugs will come to that liver. Okay, it will move to liver. In the liver, here enzyme is presented that convert that inactive drugs to active drugs. Now this enzyme convert inactive drugs to active drugs. After that it should go to the blood. Okay, again it will go to blood again, then it go to that site of action, then only it will go to that site of action. So these drugs are prodrugs. First they should go to that liver. Their enzyme is presented, converted inactive form to active form, then it should go to that blood, then it should go to site of action. These drugs are known as prodrugs. In liver, inactive is converted into active form, then it go to that site of action. But if they go to that liver to deactivate enzyme are also there. Here deactivating enzyme also there. Now first pass metabolism, drugs first go to that liver, getting converted inactive to active form, but the active version will get degraded because of first first fast metabolism. So prodrugs are not supposed to be given via oral route most of the time, because bioavailability will reduce. Because through oral route we will give dose means that bioavailability will reduce. After that the drugs is supposed to go to its site of action. After that only it goes to site of action. Suppose oral drugs we will take means that bioavailability will reduced. So drugs will reach to here. After that it circulation, after that it will go to site of action. This one here inactive form, not all drugs, some drugs only. That drugs will move to liver, then here enzyme presented, it converted inactive to active form, then it move to blood circulation, then it will reach to site of action. So this drugs name is called as prodrugs. Now we should know that list of prodrugs. What are the prodrugs examples? So This is the list of Prodrugs. A, one drug, B, 3, D1, M3, I1, C3, S1. So A stand for A says ACE inhibitor. Okay, ACE inhibitor except caprobril and lisinopril. Caprobril and lisinopril, this one not comes under ACE inhibitor. What is ACE inhibitor? That brill, all the drugs which have that suffix, all the drugs which have suffix brill. Here also it having brill, but this one are except these two things are not Prodrugs. Okay, these two are not Prodrugs. Remaining all suffix end with brill means that comes under ACE inhibitor. Second one is B. We having three drugs. That name is called Brinit, Britnizone, and proton pump inhibitor. Then pro Procronil. So what are the three drugs? Britnizone, proton pump inhibitor, and proconil. Then these is only one drugs, that tifivibrin. Then M stand for M. We having three drugs: mercaptopurine, methyl tofa, and minoxidil. Mercaptopurine, then methyl tofa, then minoxidil. Then T stand for levodopa. Levodopa we are giving for Parkinson disease. Then I for irinotecan. Then next C stand for cyclophosphamide. Then clobitocrel and carbamazole. Then S stand for sulfasalazine. All these drugs are Prodrugs. So ACE inhibitor suffix pril, except this captopril and lisinopril. This one not comes under Prodrugs. These not Prodrugs. Remaining all the suffix comes under ACE inhibitor. Then these are the drugs are example of Prodrugs. Prodrugs.